Hi, my name's Linda Bream-Cookle, and I'm Head of Policy and Practice Development at Core and Voice. This is an overview of what makes life good, our new report into care leavers' views on their well-being, published by Core and Voice and the Rees Centre at the University of Oxford. Over the past 5 years, we've collected over 10,000 care experience voices through the Your Life, Your Care and the Your Life Beyond Care surveys. Children in care and care leavers have told us how they feel about their lives, and what they have shared gives us an unprecedented insight into their subjective well-being. Our new report, What Makes Life Good? Care leavers' views on their well-being, pulls together the findings from the 1,800 care leavers who participated in the Your Life Beyond Care survey between 2017 and 2019. Here's a summary of the findings from the report. Care leavers did worse than the general population on a range of measures. For example, more care leavers had higher anxiety, lower life satisfaction, felt lonely, and were less likely to have trusted, supportive people in their lives. There was also a steep decline in well-being when young people left care. We found that compared with children in care, a higher percentage of care leavers felt unhappy, unsafe, and unsettled where they lived. Care leavers who reported that they had a disability or long-term health problem were particularly vulnerable. They had lower well-being and were lonelier and less likely to have goals and plans for the future. Compared with other care leavers, fewer felt safe and settled where they lived, and more struggled financially. Overall, although a majority of care leavers had moderate to high well-being, 30% had low well-being. Our analysis identified the factors associated with high and low well-being. Care leavers with very high well-being tended to feel treated better or the same as other young people. They felt proud and strong, safe and settled at home, didn't feel lonely or afraid, and had low levels of stress and bigger support networks, including partners. They also felt optimistic about their future and happy with how they look. Care leavers with low well-being in many ways had the opposite experience. They struggled to cope financially, hardly ever or never felt proud, excited or strong, felt unsettled where they lived, lonely, afraid or angry, and experienced high levels of stress. They didn't have trusting and supportive relationships and good friends, and were pessimistic about the future and unhappy with how they look. However, the care system can get it right. We can learn from the positive experiences of those with high well-being. We also found that care leavers do better in some local authorities than in others. For example, the percentage of care leavers with low well-being in a local authority ranged from 14% to 44%, and we saw a wide variation in the percentage who felt safe. Many young people also were very positive about the support that they received from their leaving care personal advisors. Care leavers reported higher levels of trust and more stability of workers compared with children in care. So what do we need to see change? We need to be aware of what is working and not working on a local and a national basis. We need to measure this based on what young people themselves believe is important to them. And with the Promised Care Review coming up, the success of policy and practice developments need to be measured by whether children and young people feel that their lives improved as a result of the changes that are put in place. The Your Life Beyond Care survey was co-produced with young people, so the questions that it asks, the Bright Spots Wellbeing Indicators, do just this. The indicators should be used by local and national decision makers to understand how care leavers feel about their lives and to design services that better meet their needs. We need to focus more on the 10 key issues that we found were associated with well-being. In particular, we need to improve connections and relationships, to develop friendships, trusting supportive relationships and address loneliness. We need to provide emotional and mental health support to address stress, high negativity and low positivity, and help care leavers feel good about themselves and their future. We need to provide money management and financial support to help care leavers cope financially, and improve accommodation support to help care leavers feel safe and settled where they live. In addressing these issues, we need a change of culture where corporate parents step up to be the best parents that they can be and compensate for the disadvantages that many care leavers experience by supporting them emotionally, practically, and financially. Like this care leaver says, we need to level up services by identifying and replicating the practice in the areas where young people do well. We should build on the positive experiences many care leavers report of living care PAs and make sure that caseloads are protected and PAs are supported to give all young people high quality support, whilst also helping them build supportive relationships in the wider community with friends, family, and other networks. We need to address the cliff edge of care by investing in leaving care support and reviewing and changing both the legal framework and the local practices that lead care leavers to experience a sharp drop in support when they turn 18. Finally, we also need to focus more on the experience of young people with a disability and long-term health problem. We need to get to know them and the support that they need and ensure that we measure the extent to which services work for them. Case management system must identify who these young people are, and services should report and scrutinise the outcomes for this group. Find out more about the Bright Spots programme and read the full research report on our website.